This is Average Joe PT, and last time I said I was going to give you a surprise, and this is a surprise. I'm going to talk about degenerative disc disease. Oh yes, lumbar, cervical, thoracic, neck, mid-back. This is Average Joe. We're going to keep it to the down low. All right, so today we're going to talk about DDD, also known as degenerative disc disease. Stay tuned. Here we go. All right, folks, I got a good one for you here. What does donuts, chocolate covered cherry, and cookies have anything to do with degenerative disc? Well, I'm going to give you a little idea. Stay tuned. All right, here we go. So when you're nice and young, right, let's think of this top donut, all right, is the bone above your spine, all right? We call them a vertebrae, but let's just say it's a spine bone. In the middle, these two beautiful cookies, they're going to represent the disc, and then the donut below is the next vertebrae. Now, when you're young, all right, look at how tall they are. Yeah, nice space in between. If you had any nerves coming out on the side, there's lots of room. But as you get older, what happens? The space gets shorter. That disc isn't as fat as it used to be. All right, let's take a little bit of this cookie off. It's even flatter out. Now that is an idea of degenerative disc, though it does taste very good. Love me some cookies. In all seriousness though, when it comes to degenerative disc, which was never called a disease, unfortunately, they call it a disease. It's a natural occurrence in the spine that happens as we age. The disc flattens out like I showed you in the cookie donut scenario. And as we sleep at night, fluid fills that disc back up. You get a little bit taller in the morning. So yes, you are a little bit taller in the morning than you are in the evening. Sorry for all the vertically challenged people, but sometimes you just ain't got it. All right. But that being said, so that disc, let's say the bone above and the bone below, that disc comes down more and more, and it can really irritate all the nerves on the sides as well as the nerves in the front and the back. Now the disc itself doesn't have any nerve endings to it. It isn't until that disc pushes out far enough or flattens out enough that starts to irritate either the joint in the back, which we're going to talk about probably in the next episode, depending on what the comments are below. Subscribe, ring the bell, baby. Love my subscribers. Keep bringing them. I'm going to keep bringing that content. Boom, 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 baby. All right. Now back to the vertebrae. So as we age, that disc becomes flatter and stresses that joint. And that joint behind can give you facet syndrome, which we're going to talk about probably the next time or the time after that. It can give you back spasms, all right? And so I'm going to give you 3 or 4 techniques that you can do at home, things you're supposed to do home-wise to help reduce your degenerated disc issue. Stay tuned. Bring in the treatments. Here we go. All right, folks, I'm back. Treatment number 1. Posture, magic towel, baby. Magic towel. Take it wherever you go. If you're in a car for a long ride, sit in an office chair all day long, magic towel. I'm telling you, I ought to sell this. Just take the towel, like I've always done in the past, roll it up, put a piece of tape around it so it maintains its shape. What are we going to do with this? You're literally, don't stick it at your lower back. All right, they had a tendency back years ago to want to stick it like this. All right, we don't want it like this. We want to put it down at the tailbone. All right, so down nice and low at the tailbone. You see that little white spot? That way you have a tendency not to rock your back. And what I mean by that, we call it sacral sitting in the biz. But basically you're sitting on your tailbone. This is what you don't want to do. You want to irritate that lower degenerated joint, disc, all right? Sit like this for a while. Whether you cross at your legs, terrible. Crossing at your ankles, sitting in a recliner chair. Number 1, you know how I hate recliner chairs when your back is flared up. Any other time, lazy boy all day long, all right? But when your back is flared up, you're having back pain into the hip, all right? Magic towel, stay out of the recliner chair, firm back chair. All right, you either sit all the way back, all right, so you're nice and tall, all right, or take the towel roll and put it down at that tailbone area so that you're basically doing the same thing. As tip number one, probably the most important of them all, because sitting incorrectly can stress the spine something fierce, all right? So tip number one, magic towel. Treatment technique number two, ice, ice, baby, all right? Anyways, you want to ice the back. Make sure you're doing it either lying on your side or lying on your stomach. With maybe, now if you can't lie on your stomach, at least lie on your side, all right? And then put the ice down in the lower back area for about 10-15 minutes, 3 or 4 times a day. Now, you might have to do this in bed. You might not be able to lie on the floor like, you know, some young guy like me, right? But lie in bed. Don't be putting the ice in the chair, because that's just going to, you could burn yourself, and it's going to promote the slump pattern, which is what you don't want to do. We're staying out of that. All right, so if you're not sitting, which if you're sitting a lot at work, I want you out of the chair when you're at home. The last thing you do is sit all day, then sit at home also, especially when your back is flared up. All right, so that's tip number two, ice, ice, baby. Treatment number three we're going to go into is some stretching. We'll go a little bit of strengthening. Stay tuned. We're back. Now, stretching, strengthening. We're going to do some gentle stretching and gentle strengthening when your back is flared up. Now, you can do this on the floor, but likely if your back is killing you, you're not getting on the floor. I want you to do these in the bed, and that's sufficient. That should be fine. All right, average Joe style, this is what we're doing. Home treatments that you can do to help reduce the degenerated disc issue. So, stretch number one. Pretty simple. You're going to lie flat on your back. I got a nice little pillow to keep myself comfy. And all I want you to do is pull one knee toward your chest. Just so you feel pull in your lower back, you shouldn't feel pain. Just to stretch. Go to the point where you feel a stretch. You're going to hold this position for about 30 seconds to a minute. Release, switch. Same thing. Second stretch, hamstring stretch. Now we're going to come up in this position. The whole idea is you can come behind. If you need a towel, take a towel and hold it there. If you can't get your arms around your leg a little bit because your back's in pain, and work on just gently straightening the knee. Don't worry about moving the foot up and down. Just keep that ankle and foot relaxed. Just worry about straightening the knee, getting a pull in the back of the leg. Same thing, hold 30 seconds to a minute. Rinse, switch, and do the other side. You're going to do each stretch 2 to 3 times. Now, you should feel a pull in the back. If you're starting to feel pain in the back and not stretching in your leg, you're going to have to back off a little bit and then try and straighten your knee out. All right? So that's stretch number 2. Third stretch, all you're simply going to do, done this one in the past with other things, going to cross the leg over. I did this last session with the piriformis. This is a nice stretch. Cross that body, knee to opposite shoulder. You're not rotating your back at all. You want your back to stay nice and flat throughout every stretch. Your spine and back need to be supported. Your spine does not like to be bent forwards and sitting a lot or extended a lot. When you have that degenerated disc problem, you don't want to be in the extremes of any position, bent forwards or extended. And obviously, 99% of our day is being bent forwards, whether it's working with our hands or sitting or something like that. So, needless to say, a nice little exercise to do as a caveat to this is just take the pillow. I always love this one. Now, you might not have any referral symptoms, all right, which means it's pain down your legs, numbness, tingling, something like that, and we can talk about that in another episode. All right, just take the pillow. At least get you out of that rounded sitting flex position. Lie on your belly with 1 or 2 pillows at the belly button. Lay down flat and put the ice on your lower back and lie there for about 15 minutes or so, and try and do that 3 or 4 times a day. That'll cut up that sitting too if you have a tendency to want to sit a lot, if it kind of forces you. And obviously this is going to make your back feel a lot better too. So that's a nice little added treatment bonus. It's not really a stretching or strengthening, but it's a position that helps reduce the pain. Obviously, you're going to probably want to do this in the bed. I mean, I don't have any back pain at this point, knock on wood, or something just as hard, but I'm lucky at this point. I've gone through my many phases. But anyways, I digress. The gentle strengthening exercise you're going to do is just called the pelvic tilt. All right, or abdominal bracing. There's a couple of different things. Essentially, the pelvic tilt is where you're going to rock your back, or your pelvic, excuse me, not your back. You're going to rock your hips back till your back flattens. All right. In this case, what I tell people to do is just stay relaxed and don't even worry about flattening your back, tilting your back. Just worry about just tightening your stomach muscles. Hold for about 3 to 5 seconds and then relax. And I want you to try and do that till, ooh boy, it feels like these stomach muscles are working. Hold for about 5 seconds or so and then relax. And I want you to try about 15 or 20 of those. Now those are some nice techniques to do. Now we can go into whole core stabilization and strengthening program, but that's not what this episode is about. This episode is about reducing the degenerative disc when it's inflamed and irritated. Once it's calmed down like mine is, definitely go goo-gaw. We can go ahead and show some strengthening. So leave the comments down below if you want to talk about that. I know at some point in time, I'll probably get into just some core strengthening exercises that has probably not much to relate it to just a specific back problem, but just general core strengthening. That's a nice progression. So that's about it when it comes to trying to reduce that acute or semi-acute degenerative disc that's irritated in there. So we got a little bit of stretching, a little bit of strengthening, a little bit of posture, and then the ice technique, all right, to help reduce the pain. So I'm going to go ahead and finish up. Like I always say, subscribe below, ring the bell. Thanks to all my subscribers. Keep bringing more. I'm going to keep bringing you content. All right. Here we go. So those are the treatments. Pretty simple. We got some stretching. We got a little bit of gentle strengthening. We got some techniques to help reduce the pain. We got some postural positions that we can do to help reduce the pain. And that's about it. We want to reduce that pain. You're going to go through cycles when you have this type of problem. I got the same problem. All right. I know what you're feeling. I got the same issue. I'm a therapist, over 20 years of experience, and have the same problem. Trust me, you do these few things to help reduce your problem. You're going to go through ebbs and flows of having this back problem come and go. All right. There's no quote unquote cure. We can manage it pretty well if you listen to what we're doing. I'm giving you free information here, people. People pay me a lot of money every day to tell you what I'm doing, all right? And this is for free. A little entertainment, a little humor, baby, all right? So please listen. This stuff is going to help. I know it works. The experience, the education, and doing it myself, all right? So like I always say, look up and keep smiling.